Hello and welcome to 72 Dragons Health. Howard Catton joined the International Council of Nurses as the Director of Nursing Policy and Programs in 2016. In February 2019, he was appointed Chief Executive Officer of the International Council of Nurses, a global federation representing over 130 national nurses associations and approximately 27.9 million nurses worldwide. A registered nurse since 1988, Howard Catton has held clinical and leadership roles across the United Kingdom, United States, and New Zealand, and previously led policy and international affairs at the Royal College of Nursing. As the Chief Executive Officer of the International Council of Nurses since 2019, Howard Catton has become a leading global voice on nursing workforce issues, co-chairing the State of the World's Nursing Report with the World Health Organization, and advocating strongly during the COVID-19 pandemic for better support and investment in the profession. In December 2023, Northumbria University awarded him an Honorary Doctorate of Science, acknowledging his global influence in healthcare and nursing, particularly his role in co-chairing the State of the World's Nursing Report in partnership with the World Health Organization. Welcome to this interview, Howard Catton. It is an honor and a pleasure to have you with us today.
And it's a pleasure to be with you as well.
As the Chief Executive Officer of the International Council of Nurses, how has the organization's approach evolved, particularly during global crises such as the COVID-19 pandemic? Can you share any particular events that have shaped the course of the organization?
ICN has been known for many, many years. We're 126 years old, actually, but we've been known through our history for bringing forward nursing policy on a whole range of issues, setting standards for nursing around the world. But a global pandemic put us into a very different place. So through the close contact we had with nurses on the ground, we regularly brought forward evidence, advice, information, same formula as to when I started nursing. The reality of what is happening at the bedside in the clinical environment, but putting that together not just as a picture of what was happening, but some of the issues that needed to be addressed, whether that was in terms of workload, whether it was in terms of PPE, also how COVID patients were nursed and were clinically cared for as well. Sadly, I have to say, one of the things I never expected to do when I took on this role would be to running a tally and an account of the number of nurses who passed away. And that still is a very difficult experience for me to reflect back on. But it was those moments where probably we got the most attention from policymakers and from media as well, which enabled us to press as hard as we possibly could on the changes that needs to take place. There have been other events and issues. I just briefly to say that when the war started in Ukraine, within days, we had nurses who were seeing the pictures and wanted to show solidarity and support for their colleagues in Ukraine. We established an initiative called Nurses for Peace to, again, advocate for safety protection of nurses, but also to show the reality of what was happening and going on, and to try and provide support. And we provided some humanitarian support to nurses. Most recently, one of our most recent reports, the economic power of care. Because we make the case for nurses on the basis of how they care and they bring health and healing, but they also bring huge economic benefits. And that evidence has been invisible and hasn't been recognised sufficiently enough. So our work to support nurses, is, as you can see, has taken us into issues around human rights, justice, economics, conflict and peace as well.
Thank you for reminding us of the work that the nurses do and how critical it is for health services, local and globally. Now, you talked about policy. You have often emphasized the importance of nurses having a seat at the policy table. What concrete steps are needed to ensure their inclusion at the national and international levels? Are there successful models or countries where this is already happening effectively?
The most recent State of the World's Nursing report, it showed that there's been a positive increase in the number of countries who say they have a chief nursing officer, up to about 80% now. A chief nursing officer is a good indicator of how seriously a country recognises and implements the need for nursing leadership. What I mean by a chief nursing officer post is somebody who sits as an executive at an executive level alongside the finance director, the medical director, the chief operating officer, supporting a chief executive to run an organization. They have executive powers, they have budget responsibilities, they have a team, they have managerial responsibilities within an organization. The understanding of what happens at the clinical interface and bringing that forward. And at an executive level, what happens at the clinical interface relates so strongly to your safety and quality indicators, your customer patient satisfaction scores, your health outcomes as well. That's those are some of the reasons that we advocate for so strongly as we do. As I say, I think we are making progress around the world, but when we dig deeper as well, the pipelines for the next generations of nurse leaders are not great. There's a real variable picture around the world, and obviously when money's tough, education budgets and development budgets can be hit as well. So this for us is, yes, it's an issue for now, but it's also an issue for the future.
Thank you. Definitely the voice of nurses in that making decision process is definitely important. Now, with the rise of artificial intelligence, digital health, and virtual care, are nurses part of these conversations? Can you speak about any successful digital experiences for nursing?
Based on countries that I've visited recently in Asia, a number of countries in Asia, where actually when I asked the nurses there to share with me some of the latest developments, they're very happy to, because they've been intimately involved in the creation and in the design, in the integration of technological solutions. So they have shaped how technology is being utilized. Some of the areas that I see are hugely important: giving patients access to more information about their health, about their healthcare, and help with their own decision making. But we also then see technological innovations which enable people to stay at home, have virtual support. If you've got a chronic condition, or is the reality these days as people are aging, multiple conditions as well, of course they need expert nursing, healthcare professional advice. So, but trying to put that into the home, I see lots of examples of that as well. And I see as well, one of the big bugbears, frustrations of nurses pretty much everywhere, is often paperwork. Technology can help hugely to streamline access to information, storage of information, retrieval of information, not having to keep repeating inputting information, or equally for patients. So it's the technology, it's all part of how we can improve the quality of care, the safety of care, the efficiency of care. There is massive support and help that technology can bring to the nurse-patient relationship. Hence why I say to nurses, embrace it.
Embrace it, yes. It's here to stay. Considering the outcomes of the recent 78th World Health Assembly, what were the key priorities the International Council of Nurses brought to this year's World Health Assembly agenda? Were there any victories or areas of challenge?
A couple of areas which I'd highlight as were particularly pleasing for us this year. The State of the World's Nursing Report, which we've already talked about, the data from that report informs global strategic directions for nursing and midwifery. And that strategy expired this year. So there was a decision at the World Health Assembly about whether to extend the global strategy through to 2030. And we lobbied very strongly and hard for member states to support the extension of that strategy. If we do not support nursing, I think that our chances of achieving universal health coverage, the Sustainable Development Goals, addressing the big health challenges that the world is facing, we won't do that. The world won't hit that if they haven't invested in the support for nursing. Another area that I'd flag, because it's been a really high profile issue for us for the last 3 years now, is the international recruitment and migration of nurses. We've seen a very significant increase in the recruitment of nurses from overseas because countries, predominantly high-income countries, have not educated enough and have their own shortages, so they go to overseas recruitment. But what was really pleasing was that many of the concerns and issues around the fairness, the transparency, the ethics, as well as the numbers involved in international recruitment, were reflected back in the discussion from member states as well. And there was a real desire to do more to strengthen the global policy and the global architecture. There's a code of practice internationally for recruitment of nurses and other health workers. But of course, I have to say that the whole of this World Health Assembly was very much framed by the impacts of the recent decisions by the US government. From a nursing perspective, within days of those decisions being made, particularly the USAID decision, we were hearing from healthcare providers in Africa whose funding stopped or was about to stop, and nurses who were being laid off, and public health programs that were being stopped. This is deeply concerning for us, as I know it is for many others, because frankly, we know that health, disease and illness and infection, doesn't stop at a national border and wave its passport and ask for entry. The pandemic, if it told us nothing else but the fact that, to be prepared and to respond to a pandemic, you do that most effectively when you do it together, not when you try and do it in isolation. And we saw the economic impacts of the pandemic around the world as well. So, the evidence about the importance of thinking about health, not just locally, not just nationally, but globally as well, and acting in cooperation, not in competition. And we're going to do the best to protect our people in our countries through working with our friends, with our neighbors, with our colleagues internationally.
Thank you. I know there's so much that can be said about the key role that nurses play and how important it is. But Howard Catton, we wanted to thank you for joining us today and sharing your insights, conviction, and vision for the future of nursing. We're grateful for your time and commitment to the profession, and look forward to the continued influence of your work on health at both local and global levels. Thank you very much.
It was my pleasure. Be well, be safe. Thank you.